I believe firmly in a holistic approach. And that takes a whole lot of people, a whole lot of disciplines who learn to work together and flow together. If it hasn't worked before, then we got to think out of the box and do some things that we haven't done before, to make this whole process better. I'm fearful that once a child reaches middle school, high school levels, it becomes more difficult. And if we can reach them now, and somehow reach the family, then we're going to affect a generation of kids.
It's just those simple, small little things that kids really pick up on, and it really makes their day. It makes them feel good about coming to school. The fact that they see someone that's always there and they know that I'm going to be at an assembly or whatever's going on, they always see my face. And that might be a constant for them, that they're like, oh, there she is.
You can tell the people at iCare really listen to you, so they're not just like hearing you, they're also listening. So I think that that's really great.
And let them know that you are somebody. You're the most important person with me here today. And to just see that effort. That's what I look for, effort. You got to try.
Once iCare came in, we started to look at things at a deeper level, from an early screener to conduct reports. It just helped us to really put a lens on what we do here at school, to see things about children and children's needs that we weren't picking up on before.
When we first were introduced to the iCare services, I wasn't sure how I would be using them in the classroom, how it would be different than the social services that we already have in place. Now, I cannot imagine teaching without the iCare services.
We're based at the school, but we really work with the greater community. So not only does that help parents to feel more comfortable with us, but it also helps teachers and school staff to feel more comfortable with us.
It's just the attitude. If the attitude changes of the kid, she does better in school. If the attitude stays the same, the kid is not going to learn.
Now I'm coming to school, and the way I am now, I'm not that worried as I was before, because I know if there's something wrong, I can just talk about it with you, and then you guys will try to work something out.
You feel it when you walk in this building, and it was good before, but now it's really good. And I feel like we have the ability now to meet much higher percentages of need for our children.
We do have the Ministerial Alliance, which was formed as part of iCare just to have the faith-based community for support. If I can't help them, I know who can, and it's going to be someone that cares.
When you look at the goals of iCare and that early intervention, it flows seamlessly with what we know about mental health and what at the state level and at the national level we've been talking about violence prevention and dropout prevention. It completely aligns with that, and it provides the resources to make sure that that work happens at a really high level. So we're doing the work in schools, and we're working really hard to do it with the best integrity, but there's just so much that can be done, and the iCare initiative has allowed us to do it at so much higher of a level.